Good afternoon. This is Dr. Larry Kidd here at Henry Mayo Newhall Hospital here in Valencia, and we're once again coming to you on Facebook Live. And joining me again, you guys are familiar, Dr. Bud Lawrence, who is our medical director for the emergency department. And today we will focus a little bit of our time on what individuals are starting to see in the news or having concerns about related to increase in COVID transmissions, the number of positive cases that are being seen in the community. And with that, it is not something that wasn't unexpected. We have a lot more individuals that are being tested. So as a result, we're starting to discover that there is more COVID transmission in their cases that are being identified. And we do want that. We want to identify individuals so that they can self-quarantine, that they can get appropriate care if that is the case. And in our own hospital, we are seeing some increases in admissions to the hospital. Fortunately, we're not seeing critical patients as we had seen before. We're not having the numbers of patients on ventilators and that sort of thing. But we do have a few more than we've seen in previous weeks. Dr. Lawrence will be speaking more about whether or not this is a surge per se, and also will give some feedback and tips around this 4th of July coming up. This weekend is anticipated to be a busy weekend in terms of individuals being out and about. So, Dr. Lawrence.
Absolutely. Thank you, Dr. Kidd. So, yeah, I think one of the questions I'm getting all the time is this a surge? Is this the surge? And I think that we have to kind of keep things in perspective. I think Dr. Kidd kind of encapsulated that very well, which is I don't, as a physician, or I should say I'm not surprised that there are more cases right now. Number one, we have opened things up. People are out in the community. We know the virus is there. So it's not unexpected that we have more cases. And as Dr. Kidd said, we want to identify those people with more testing, which is what we're doing, which is identifying more cases. And we want to be able to treat those people appropriately. So I think that when you look at this being a surge or not, it varies geographically. If I want to talk a little bit about Santa Clarita, about our hometown here, I would say no, I don't really think we're having a surge or the surge. We are, yes, seeing more patients. We do see patients coming to our hospital and being admitted slightly more so than a couple of weeks ago, but those patients aren't nearly as sick. And I think that I think that what we're seeing in terms of numbers of cases increasing correlates well with how we've opened up our community, our businesses, our social life. So it's not unexpected to me. That said, a small percentage of patients that do get coronavirus or COVID-19 will get fairly sick. But remember, as we've always said, the overwhelming majority of people who get this disease or this process will be just fine. So I think you need to keep that in perspective. I think you need to remember that nothing has changed since March in terms of this virus being in our community. You know, we still advocate wearing your mask. We still advocate hand washing, not touching your eyes and face, trying to stay 6 feet away from people. All those things are just as important now as they were before. And I think you just have to keep perspective on that. As a physician, I'm not overly concerned about where we are with respect to Santa Clarita. Other geographic areas may have a higher caseload, even within the LA County area. But locally, I am where I would absolutely expect us to be.
Right. So with that, we will also probably see up and down in terms of numbers of cases over a period of weeks and even months, given that as we continue to test, as Dr. Lawrence said, we will see more cases. As things open up in the community, there's going to be more people that are interacting and so forth. And the key to that, as Dr. Lawrence indicated, is that we must continue to be vigilant in terms of those things that we know do in fact prevent transmission. Wearing of masks when you can't socially distance. The other is, of course, always frequent hand washing is key to ensuring that you're able to disinfect your hands, so to speak, such that you don't contaminate your eyes or mucous membranes, your mouth, etc., which is the common way that the virus is transmitted. We have been open here at the hospital for several weeks now with all of our outpatient services, our emergency visits. We're starting to see patients come back that we had not seen in the numbers before COVID, with all kinds of other illnesses that individuals still do need to come to the hospital to receive care for in that regard. I'm pleased to say we've had absolute great success in terms of managing our PPE. We have the appropriate equipment that's required, masks, etc., that we've talked about in the past. All of the waiting rooms and the various areas that patients are sitting, waiting, receiving treatment, etc., have always been disinfected, but those additional measures we put in place are working quite well, and we find that when folks come for their care, they seem to be quite comfortable with what they find, and we're getting good feedback as well about how folks are feeling when they come for care. So we're pleased to say that things are running well. We want to continue to be able to serve the community in that way. So we are here for you to provide whatever services are needed for your health care.
Absolutely. We call it safe in our care. That is the what we're trying to let the community know, that if you come here, you are safe in our care. We're taking the appropriate precautions, and you should feel comfortable not delaying your medical care, whether that be seeing your regular doctor, getting a mammogram, or coming to the emergency department. All those things are very, very important. One thing we can talk about is question I get often is, what happens if I was exposed? If I know somebody that I was around and that person turned out to be COVID positive, because we were just talking about there are more cases in our community. I think the important thing to know is that yes, this is a contagious disease, but it is not as easy probably as most people in our community think to get COVID-19. Certainly we have to be cautious, but you really have to have a bit more of a prolonged contact with somebody than you might think. So if you were concerned about an exposure or a potential exposure or what you feel might be an exposure, first thing to do is monitor yourself. You want to make sure that you're taking your temperature, ideally twice a day. You want to monitor for symptoms like shortness of breath, cough, obviously fever, nausea, vomiting, diarrhea, just anything that's out of the ordinary for you. And you might want to consider wearing a mask, more so than you might just being outside, maybe even around your family members. But again, I think that the majority of times that people come to me and say, I think I was exposed, when you break it down in terms of the amount of time you have to be with someone, you not wearing a mask, they not wearing a mask, within 6 feet, up to 10 minutes time you need to spend around those people, much of the time it's not a real high risk exposure. But we do have to be cognizant of these exposures. The virus is making its way around the community. So if you are concerned and you want to be tested, which would be the next thing if you did have symptoms, or maybe you don't have symptoms and you just want to know, you should know there are many avenues to be tested. I think at least 4 days a week, Thursday, Friday, Saturday, and Sunday, the COC campus is hosting testing. Also, our emergency department, we're open 24 hours a day. We're happy to test people. And there are many urgent cares, if not most all urgent cares in the area, that also can provide COVID testing. So the last step of the exposure will be just to get a test to understand, but know that test, if it is negative, is only negative for that moment in time, and you may need to get a test again at a later date.
Right. We've had a few questions about treatment of COVID patients that present to the hospital, should they need to be admitted or otherwise. And for the most part, individuals that present that are positive for COVID, they don't require hospitalization. The symptoms that they might have can usually be managed at home. Sometimes headache, those kinds of things would be the normal kinds of things that you would treat those type symptoms for. On the more advanced treatment protocols and whatnot, we do follow guidelines that have been established by the medical community in terms of some of the drugs that you've heard about. We have access and availability to those and they have been used in some instances. We're still continuing to see patients recover that are hospitalized and resume their normal daily activities once they return home, and in some cases lower level of care. We have a few patients that come from assisted living and that sort of thing, and they're able to return to their facilities. Again, we are not at all surprised that we're seeing more COVID positives in the community. We have had some inquiry about the news reporting that the number of people showing up recently have been in the younger age category, less than 40 years old in many cases. And again, a lot of that has to do with more testing, things that opened up where younger people tend to be congregating or having various activities. So again, not surprising that we're seeing some younger folks. It's not that it's shifted to just be younger people, but they are in environments where they're in contact with other individuals. So young people out there and otherwise, wear your face covering and wash those hands.
That's absolutely right, and I think that really also points to the fact that I think our community is very well educated for the most part about COVID-19. I think there's been a lot of news. There's been things like this Facebook Live, trying desperately to educate everybody, and I think most people in our community have a great knowledge of that. I think that perhaps our elderly members of the community are really doing their part to distance themselves in terms of their risk of getting COVID-19, and I think that's a take-home message when you talk about things like gatherings. So 4th of July is coming up. That's a holiday notorious for big public gatherings, barbecues, a really great holiday to get together. So we have to sort of, one of the questions I get a lot is also, what can I do? Can I have people at my house? Can we not have people in our house? Do we have to be outdoors? So I'm going to take a completely apolitical stance on this, which is I would say that you watching this, as well as the rest of our community members, have been pummeled with education about COVID-19. And I think you're educated enough to make a decision about your risk tolerance and what you want to do. So if you have zero risk tolerance, you're elderly, you've got immune compromised issues, you have multiple medical conditions, you feel that you are not safe being around other people, don't get together with somebody. If your risk tolerance is zero, don't get together. If your risk tolerance is a little bit more, maybe have people over at your house outside, everybody wearing masks. If you have much less risk tolerance and you feel comfortable with people that you trust are telling you that they're not sick and you want to have them in your house, that's up to you. I think our community is at a state now where the education piece is out there, and I think that we are all knowledgeable enough to make that risk decision for ourselves to decide what you want to do, not only for 4th of July, but in other areas. Now, I will tell you the government has really sort of said, hey, you shouldn't really get more than 10 people together. I think that should be taken into consideration. I think there is definitely some risk with having people in your house congregating, not staying 6 feet apart, but that's something that you need to make that decision for yourself, and that's something that I'm sure many people will be making that decision this 4th of July.
Right. Great advice, Dr. Lawrence. And again, the education is out there. This community in particular has done a great job in terms of following the guidelines that we've presented here on Facebook Live, information that we've presented on our website, henrymayo.com. And as a result, I think we've done a great job of managing the circumstances that we find ourselves related to COVID-19. And the key is to continue to do that. Follow that education that has been presented and doing what you have been doing, which has worked. We know it's been effective in those areas of the country that you hear about where those guidelines have been followed. They've had fewer cases. They have not had the outbreaks to the extent that you hear in some other places where they really don't adhere to those guidelines. So with that, we're coming to the end of our time today. We do wish that everyone out there has a very safe and happy 4th of July holiday coming up. It's going to be a little bit different again this holiday around, but eventually we're going to find ourselves out of this circumstance, and we'll be able to open up more and more over time by following the guidelines that have been put in place. So again, thank you for tuning in today, and we look forward to seeing you again next week.
Take care, be healthy, be well. Have a great 4th of July.